Well, a warm welcome to this talk, Wednesday the 14th of July. Now, I'm just going to start off with something Dr. Tedros from the World Health Organization have said. Now, we've had our discussions around the World Health Organization, but I think this is fairly unambiguous. Direct quote, Delta variant is ripping around the world at a scorching pace. This is the case. It is ripping around the world at a scorching pace, unfortunately. Otherwise, this pandemic would have been pretty well over by now, at least in Western countries. Now, a few orientation slides first of all. I'm going to start off with English-speaking countries first of all. So here we have the situation. So we're going to get a special report from Australia later. New Zealand, low of course. Australia, worrying cases now in Sydney area, in New South Wales, and also in Victoria now. Canada still going down. United States, definitely an upward increase. Ireland, an upward increase, consistent with quite a few places in Europe, unfortunately. Now, South Africa cases were going up. And of course, if you've been watching the news, you'll realise there's been, well, anarchy really in parts of South Africa. So the data hasn't been collected for the last few days. So unfortunately, I don't think this is a genuine dropping off or levelling off here. It's due to the situation in South Africa. If anything, the current riots and looting and lawlessness in South Africa will make this worse. South Africa going into winter, of course, and United Kingdom, well, dear me, speaks for itself really, doesn't it? Cases are still escalating dramatically quickly in the UK. Moving on to Europe. So we still see that the UK is worse than most places in Europe. So I've left the United States on for reference. Belgium, Denmark, Greece, Portugal, Spain, Netherlands, UK. But I think you'll agree that all of these, Germany's not so bad actually, Norway, Finland, Sweden not so bad. But I think you'll agree that all of these countries, well, Netherlands, dear me, Spain, showing a dramatic increase, Delta variant driven. We've been anticipating this for some time. And the worst country I've kept till last, Cyprus. So that's like double the cases of the UK. I mean, astronomical, exponential increase. I mean, if you look at the increase in the UK, then the steepness of the Cyprus line, that shows you what the Delta variant can do without the right inhibiting measures in place. So no question here there's going to be some difficult times ahead in Europe. Now I just want to go on to the UK now. I want to show you this from the UK. So here we have some UK figures. Now we see the vaccination programme is going still quite well. But let's look at the new, let's look at the summary here first of all. So 27% of increase in positive tests in the week, 42% of deaths within 28 days and 53% increase in admissions. Now, fortunately, the deaths and admissions are still relatively low. But if we look at cases here, we do see the increase is starting to look quite dramatic and it's becoming a well-formed third wave. So that was the Alpha variant wave, Kent variant. This is the Delta variant wave. Variant first identified in India. Going on to healthcare, we do see increases. So increase in case people admitted to hospital. So for example, it's up to latest daily total there, patients admitted 538. Patients in hospital, 3,615. So that's the patients in hospital. Nothing like where we were, but it is starting to put some pressure on health services in some areas. Deaths, well, again, we're starting to see a slight increase as we have predicted for some time in the UK. So dramatic increase in cases in the UK continues. This is going to continue for several weeks yet. With the easing of restrictions on the 19th, we've got to really carry on almost as normal as we are now, even though it's not going to be a legal requirement. Otherwise, hospitalizations will start to go up quite dramatically. And we already have such a backlog of people waiting for care. This really is resulting in a lot of suffering and some deaths, unfortunately, because of the backlog of ordinary care that we simply haven't got round to. So, ripping around the world at a scorching pace, Myanmar, the country that used to be called Burma, at least 5,000 cases in the last 24 hours, up dramatically. Now, testing in Burma is very poor, and of course we know that they've recently been taken over by the military. Civilian leaders are imprisoned. Many protests, riots on the street. Terrible situation. So this is the absolute minimum number of cases. They're the ones diagnosed. But what's more concerning to me than this number of cases is the positivity rate, 25%. And actually in a city that used to be called Rangoon, now called Yangon, I think, it's nearer a 33% positivity rate, indicating massive rapid community transmission in Myanmar. Very low vaccination rate, very limited access to healthcare. News is difficult to get, so I went to Radio Free Asia. Now, this is normally pretty good. There's the link there. Click on it. The website is usually pretty accurate, actually, Radio Free Asia. So I've used that one. They're saying coronavirus treatment facilities at capacity already. Hospital beds and oxygen at short supply already. Rationing of healthcare. Patients deemed either too sick to be saved or not sick enough are turned away. Of course, this means a lot of people are at home without oxygen. Therefore, lines of people looking for oxygen in Yangon and Mandalay, the city that was Rangoon. Because people being turned away, they can't get into hospital, so the relatives are desperately foraging around for oxygen to try and find it, which they're not finding. And there are many reports in that Radio Free Asia report of people dying from oxygen shortages in Myanmar, and that's only going to get worse over the next weeks as well. So another example of just a sad situation. Without the military unrest there, the situation could have been so much less damaging to so many people. Now, Taiwan. Taiwan, interesting. Here's the graph. They did so well for such a long time. Then all of a sudden, a lot of cases. But look at this. Even though it's largely Delta variant, they've got this under control in Taiwan. Now, this is truly impressive. And this is despite limited vaccinations. Political difficulties, of course, getting vaccines from China. Japan has so the United States have sent some vaccines. Japan to supports Taiwan more and more now. AstraZeneca, they're sending a total of 3.3 million shots, or they've sent that so far, and they are sending more. So this is largely with non-pharmaceutical old-fashioned interventions. Pretty impressive performance there from Taiwan. China, relatively low numbers of cases in China. Vaccination program going very well. 1.39 billion doses of vaccine given out so far. So that is going well. And the Chinese, I believe, are looking into getting some messenger RNA vaccines as well for a potential booster dose. So that was interesting. Now, vaccine mandates. Dear me. I mean, I was asked this question on Deutsche Welle in the interview on the German TV yesterday. And, they said, what about the ethics of mandatory vaccination? And I gave the arguments for it and the arguments against it. And dear me, the response from people, the emails full of vitriol. How dare you support mandatory vaccinations? And I was doing no such thing. I was just giving the cases for and against this situation. I was careful not to support it or to detract from it. So lots of furious comments like unsubscribe, big letters, capital letters. You are, and really some things really quite, abusive. Really. It doesn't bother me too much, but it's interesting. So the debate over reopening in the UK and this issue of mandatory vaccinations potentially in some areas is evoking very, very strong emotions, very strong emotions indeed. The level of emotions I haven't come across before in this pandemic, it has to be said, perhaps with the exception of fear in the early stages. So just to try and report some of the facts here, France and Greece are mandating vaccinations for healthcare workers. It's in lots of popular news outlets. So Emmanuel Macron, President Macron, facing a strong resumption of the epidemic in France. Apparently, that is patently true. The French numbers will be going up pretty soon and are going up now to some extent. Could lead to rising hospitalizations this summer. I'm afraid that is likely. Let's hope it's not rising too much. Vaccination in France is picking up quite steeply now. They are catching up. Slow start from the European issues that we discussed at the time, but about 51% of over 18s now. President Macron again, the equation is simple. The more we vaccinate, the less space we leave this virus to circulate. So that is true. Now, again, I'm getting quite a lot of attacks on this. People are saying, well, what about antiviral drugs? What about ivermectin and things like that? I mean, from my reading of the literature and from talking to experts, it does appear ivermectin would be an effective prophylaxis and an effective treatment. That's my current understanding. And I have publicly called for governments to make declarations saying yes or no on ivermectin. But the point is, it's not going to happen. Chris Witt is not going to go on the podium next time there's a Downing Street briefing and said, I'm going to start using ivermectin. In fact, he's not even going to say, I'm not using ivermectin. They're just not going to comment on it. It's just not going to happen. So that leaves us the prophylaxis of vaccination. I'm no happier about it than any of you are, but it's where we are. This is the realpolitik of the situation. This is the practicalities of the situation. And it's not going to change. We are where we are and we have to make the best of it. Privileged access to indoor dining, entering shopping malls, cinemas, travelling on planes and trains. So basically, 2 vaccinations is going to be mandated to do anything in France pretty soon by the sounds of it. And as well as that, they're starting to charge for PCR testing. Now, this is an interesting move on behalf of the French, I must say, and quite a clever move, really. So to do things like to travel on an aeroplane or, to eat indoors, you need this COVID pass on your phone. And you can get a COVID pass if you've had the evidence of the infection recently from a positive PCR test, or you've had a negative PCR test in the past 3 days, or you've had 2 vaccines. So what people have been doing is just every time they want to go for a few drinks, they just book themselves in for a PCR test, and that makes their COVID pass work. Well, these PCR tests aren't cheap, and the French authorities are starting to charge cost price for them, as I understand it, which is probably around about €50 a throw. I don't know how much they're charging, actually. But as soon as they announced they were going to charge for the PCR tests, tens of thousands, literally tens of thousands, of people went onto the website to book vaccinations because they're going to need the double vaccinations rather than paying out 50 quid every time they want to go out for a few drinks, or €50 or whatever the cost is. So the financial situation has somewhat made the spirit move in France. President Macron, he said, put restrictions on the unvaccinated rather than everyone is his approach. So he clearly wants to differentiate between the vaccinated and the unvaccinated in the French population. Clear strategy there in France. Prime Minister of Greece, vaccinations a bit lower, 45% there. They're starting to vaccinate 15 to 17s later this week. All healthcare workers must be immunised, mandatory by the 1st of September. Absolutely mandatory. So healthcare workers mandatory in France. Healthcare workers mandatory in Greece. Nursing staff required to begin receiving vaccinations immediately. Only fully vaccinated allowed to use public indoor spaces until the end of August. So we see mandatory. Now I think it was Italy. So mandatory in France and Greece. Italy, they said some while ago that healthcare workers must be vaccinated or you get a year-long suspension, which basically means it's mandatory. And of course, the year-long suspension is without pay. So we see mandatory vaccination coming in for healthcare workers in France, Greece and Italy. And basically, unless you want to keep paying for PCR tests, vaccine has essentially become mandatory for indoor dining, shopping malls, cinemas, travelling on planes and trains in France and to some extent in these other European countries as well. So that is where we are at with that. Now, the arguments I put forward yesterday on the Deutsche Welle interview was the only time in the UK where you can be forced to give someone treatment against their will is if they are under a section of the Mental Health Act. So all of my patients on an A&E department or a ward, they'd all be voluntary patients. So you need consent for everything. Now, very often this is just implied consent. So you'll go to take the patient's blood pressure and they'll put their arm out. That's implied consent. You don't need to say, I'm going to take your blood pressure to have your permission. That's implied consent. Other things, of course, it's signed consent for surgery and things like that. And if a patient comes to me, if I'm giving out some medicines and the patient says to me, I don't want to take this medicine, then that's fine. I don't force them to. I can't force them to. They are completely free to accept the treatment or not accept the treatment. Or I've been carrying out treatments on patients before and they say, look, I'm not coping with this. Can you stop doing this? So, of course, I stop doing it. They have complete freedom of choice, unless they're under the Mental Health Act where treatments and drugs can be given forcibly. So it's fundamental principle in healthcare that we can't force people to have vaccines or drugs that they don't want. That's absolutely true. It's a human right, and I made that point on Deutsche Welle last night, although, of course, you have less time on these programmes. But there again, I said the employers have a duty of care to protect their staff. The employers, the hospital managers, have a duty of care to protect their patients. So if their patients get COVID-19 from non-vaccinated staff, it could be legally argued that they failed in their duty of care. So you can see the argument from both sides. That's basically what I was saying. And I expect that's going to generate some vitriol as well. It's funny, people hear what they want to hear, and they often take offence when they want to take offence. But I'll just say it as fairly as I can, and that's my current appraisal of the situation, based on what I've done over 40 years of practice. Right, United States now. Now, let's have a look at the United States here. So, the first one, well, we know cases are increasing, of course, in the States. But hospitalizations are increasing in some areas. Missouri, for example, which is a greatly under-vaccinated state, I've actually had quite a few younger patients in, many of whom are actually quite poorly, and some children. We're really hoping this isn't a trend, but people around the world are saying that younger patients are being affected by the Delta variant, which of course is becoming the dominant variant in the United States, and that people are getting sicker quicker, especially contacts in Africa have been saying that. So younger people being hospitalised and other patients getting sicker quicker. And that is starting to be reflected in the US data here. So this is emergency department, what we call casualty or A&E departments, diagnosed COVID-19 in the United States, all ages. So we see that July it's starting to go up again. And hospitalizations are on a similar trend. So we see a definite increase there in the United States as the Delta variant spreads. And the other concerning thing about the States is this graphic here. And again, ivermectin isn't going to be approved anytime now in the United States. So vaccination is what we have. And the rates are dropping off. These are the daily rates now, and they are still getting lower. Just over 500,000 there for the whole United States. 7-day moving average, 435,000. And the latest projections are lower still. So many more vaccines available than arms available to put it in the States. Now, I've been watching quite a few videos of vaccinations around the world, and most people, it seems, are not aspirating. It really is a pity. I wish everyone would just aspirate so we could get rid of that variable for the development of vaccine complications and side effects. So it would be good to get rid of that variable. Now, we're going to go to Dr. Sumadin Mahane, who's a general practitioner in Sydney, where, of course, there's been a great surge in cases driven by the Delta variant. So thank you very much, Sumadin, for coming on, and over to you without further ado.
Hi, John. Thanks for having me. I'm Sumadin Mahane. I'm a general practitioner from Sydney, Australia. Today I'm going to give an update on COVID situation in Sydney. As you know, we are under lockdown last 2 weeks, and in spite of the lockdown, the cases are increasing. Under the lockdown, we are permitted to get out of the house for 4 reasons: either to go to work or to look after the elderly parents, essential shopping, and to do exercise. People are very confused what is meant by essential shopping. All the shops are open and people are doing shopping everywhere. They're buying cosmetics, clothing, printer, computer, because it's essential for them. And also I have seen many people walking along the road as normal. The parks are full because they claim they're doing their exercise. So obviously our lockdown is so soft and it is not working. So recently the government has tightened the lockdown situation, saying only 2 people are allowed to get out to do exercise, except the households. Only 1 person per household can get out to do a shopping once per day. Despite of this, the cases are escalating from 30s, 50 next day and 70 another day, and reaching a triple digits. All across Sydney, mainly the southwestern part of Sydney, which is predominantly ethnic population. Only 24% of the people speak English at home. So you understand, they don't understand the rules of the COVID. Each household has about 5 or 6 people, and they live in a 2-bedroom flat and a 3-bedroom flat. Imagine one household get an infection, invariably the whole house get infected. So that's the main problem. To the cases are escalating in those areas. So recently government has put a public hub to vaccinate them. They increases the number of police to patrol that area to catch the people, those are breaking the COVID rules. Also, they try to communicate through their community leaders and their social media, try to educate them in their languages. I'm sure that will have a major impact in the next coming weeks. Now the COVID cases, even the hospitalization, for an example, this is the hospital cases on Sunday the 11th, and you can see most of the people are under 35. They are young adults, and they don't have any comorbidities either. This is a graph. You will like this, John, the graphs. This tells you the hospitalization in blue, and the orange are in intensive care, and the red are those who get under ventilator. You can see the graph rising. And this is our latest update, which is announced last night. Unfortunately, we had the first death due to COVID infection. A 90-year-old lady contracted the virus through their relatives. So that says how important the vaccinations are. Because in New South Wales, we have 8.1 million population, and around 5.3 lives in Sydney. But our vaccination rates are only 9%. And you know our population are a little hesitant to get the vaccination, especially the AstraZeneca. Because of the clots and the death related to the AstraZeneca, which announced in the media every time, they don't want to get the vaccination with AstraZeneca. Now we are getting a Pfizer vaccines, which is we were getting 300,000 doses per week since June, and now they are increasing the doses from next week up to 1 to 1.4 million doses per week. I'm a COVID vaccinator. I do give AstraZeneca 2 doses 12 weeks apart. Recently, we were giving 2 doses 6 weeks apart, advised by our government. And also we have started giving the Pfizer vaccine through the general practice. Even we give 1 million doses per week, it will take John 20 weeks to get the whole population vaccinated and reaching our target vaccination rate. So I feel the vaccination is the only way to control the spread of the infection, mainly the Delta variant. I'm very cautiously optimistic we will meet the target and we will get over this spread in the coming weeks. Thank you.
So, Emmanuel, thank you very much for that excellent, clear report. 112 cases in Sydney, and these are community spread cases as well. So it is a concern. 9% vaccination. People living in fairly confined quarters, as you say, the whole household is guaranteed to become infected, and increased cases in Victoria as well. So it is remarkably concerning, the Australia situation at the moment, and I still think it could go either way, but the news is not good at the moment. So thank you very much for that report, Samadin. Excellent to hear from someone on the ground in Sydney, as always, and somewhat surprised to hear how lax the lockdown is, with cosmetics being bought as essential shopping. So there we go. Okay, so that's us for today. Thank you, Samadin, for that report, and thank you for watching.